This is Krista. Welcome back to MadeToBeWhole. I have been feeling a little under the weather. Well, actually a lot under the weather, and I'm not going to be able to record this week, so we are replaying one of our favorite episodes. It's about sleep, which is key to health. Take a listen, and we'll be back in a few weeks. This is Krista. Welcome back to MadeToBeWhole. Stay tuned for a riveting discussion on insomnia.
MadeToBeWhole is intended for informational purposes only. It's not intended to replace the advice or care of a licensed healthcare professional. Participating in this podcast does not constitute a provider-patient relationship with Krista Michener, AHP Integrative Health, or any of the guests featured on MadeToBeWhole. Krista Michener, AHP Integrative Health, and any featured guests aren't responsible for any losses, damages, or liabilities that may arise from use of information obtained in this podcast or associated materials. Please consult a healthcare professional for any health-related concerns that you are experiencing.
So we are going to talk about sleep. Sleep is a big deal for a lot of people. Some of them it is, and they don't even realize it because I don't think they have a concept of A, what healthy sleep looks like, and B, what that can do for you. They're such widespread ripple effects from good or poor sleep that affect us physically, mentally, socially, vocationally, financially, so many different things. Why does sleep matter? Sleep deprivation is actually used as a torture tool because it's that big of a deal. When you don't have enough sleep, physically, you're going to have increased pain. There's obviously fatigue, but poor sleep is also associated with heart disease, worse outcomes in diabetes, impaired immune function. With mental health, is sleep deprivation or insomnia the chicken and the egg? I think that sometimes we treat insomnia just as a symptom of anxiety or depression, which it absolutely can be, but there are times that it's the sleep that's actually causing the anxiety, the depression, even a bipolar type presentation. So sometimes just addressing sleep, other things fall into place. Other times you have to go the other way, and by addressing the mental health, the sleep corrects itself. But I think sleep is always a good place to start. Obviously, there are social repercussions because if you are sleep deprived, that's going to affect your relationships. It affects your ability to be attentive, to be kind, to be thoughtful. When we're sleep deprived, we're generally irritable and not very nice, and we're just kind of dragging through. So that's going to affect your social life. And then vocational, clearly productivity is an issue. When you're sleep deprived, you're less productive. You don't need a study to tell you this. Try doing the same task after a good night's sleep versus the night that you didn't sleep, and you know the difference. So insomnia has a couple of different subtypes or definitions. Insomnia generally, colloquially speaking, just means I can't sleep. But I know I used to think insomnia was just the person who was up pacing all night, couldn't sleep at all, when in reality, it can look different than that. For some people, it's the falling asleep part. Like once they're asleep, it's all good, but they have a lot of difficulty falling asleep. For some people, it's staying asleep. So they fall asleep and then they're up at 1, they're up at 2, they're up at 3. For some people, it's combined. For other people, it's this early morning awakening. You wake up at 3:30 or 4, regardless of when you go to bed, and you just cannot go back to sleep, even though you are tired and you want to sleep. Obviously, we have some individuals who are just built differently. Some people who need more or less sleep for optimal function. But I would propose that the person who really is fine with 6 or fewer hours of sleep is a very rare exception, and that a lot of people who only sleep that much or purport to only need to sleep that much probably have some decreased productivity, maybe relying on caffeine or other stimulants to keep them up and going, and would actually do better in life with a healthier amount of sleep. Conversely, there are individuals who require a lot more sleep. There are people who need 9 or 10 hours of sleep a night. There are individuals who may be chronically or acutely ill who require 12 or more hours of sleep because the immune system is very active during sleep. There is mitochondrial repair that happens during sleep. So you have to have an adequate amount of time for all of those processes to happen. So then looking at insomnia, the big question is what causes it? And that is a really, really wide net with a lot of possible contributing causes. I think for some people, it's straightforward. For some people, it is multiple things or the accumulation of vulnerabilities that pushes them over the edge. And something to consider when you're assessing yourself, you can't say, well, I know it's not that Diet Coke I drink at 6 because I've drunk Diet Coke at 6 p.m. for the last 10 years and I never had sleep problems until recently. But it could be contributing now because you're not the same person that you were 10 years ago. So you do have to look at all of those factors. Environmental things that can contribute to insomnia. Some of it is a no-brainer. Noise. If you live in a noisy environment, some noise you may be able to mitigate, some not. If you decide to have children, there's going to be unwanted noise at night for periods of your life, and that's okay. That's what you signed up for, and it's worth it. Light, this can be light from screens. This can be you trying to sleep because you work third shift and there's too much external light. It can be air quality. Mold can affect sleep, other poor air quality things. Lack of movement can be an issue, but also just movement in the environment around you. Emotionally, obviously, there can be really big triggers to insomnia. One of them that I think is really important to address is that if you have an immediate persistent threat to your safety, if you're living in trauma, you're not going to be able to sleep. And that's not a medical problem that you have. That's your body's survival mode. You're in fight or flight because you are patrolling and protecting yourself, and trying to medicalize a safety response, I don't think is healthy. The most important thing to do is to be in a safe environment. Now, even when that happens, when people are out of trauma, the body has this tendency to stay in fight or flight mode. And that has to be addressed so that you can eventually feel safe in your body despite your past. You can't leave the past in the past. It still remains with you. You have to decide what you're going to do to deal with the effects to create a safe physiological state. We mentioned caffeine, but other dietary things. Caffeine is a stimulant. Alcohol is terrible for sleep. Alcohol is a sedative. It can help people fall asleep, but it yields non-restorative sleep, fractured sleep. There's less REM sleep. Alcohol is not a good way to treat insomnia and is perpetuating the cycle. Another thing I think should be assessed is medication side effects. Are you taking a medication that has the side effect of impaired sleep? There are a lot of medications that are marketed for mental health conditions that can cause insomnia, or conversely, for some people, somnolence, feeling tired. You could also look at, with medication side effects, is it possible that you're taking something during the day that makes you tired and you're napping during the day, and that's what's driving your insomnia? So looking at medication is important. Lack of routine also contributes to insomnia. Routine and schedules aren't just for babies and children. Grown-ups need and crave them too. And if you're struggling with insomnia, having a routine can be helpful. Your body knowing, generally speaking, you go to bed between 9 and 10 every night. Or if you're a night owl, maybe it's between 11 and 12, but having something consistent, trying to get up around the same time, having some consistent routines prior to bedtime can help prepare your body for sleep and facilitate good sleep. Hormones are another huge contributor. Some of the hormones that can affect sleep include our sex hormones. That would include progesterone, estradiol, or other estrogens, testosterone, DHEA. Those are really important to assess. Progesterone, particularly, can be amazing for sleep. A female who has anxiety and sleep problems, I'm always going to want to look at hormones, particularly progesterone, because progesterone can be just magical for some people. Another hormone that you need to look at is cortisol. Cortisol is your body's stress hormone. You need to have some cortisol. It would be bad to have none. That's an entirely different medical issue. But high cortisol can create anxiety. It can contribute to racing thoughts, sleep problems, that sort of thing. Both of those things are addressed in our foundations package. One of the reasons I like the 24-hour saliva collection for hormone testing is because it shows me patterns. So if I send you to the lab and you have blood drawn to check estrogen, testosterone, DHEA, progesterone, that's fine. That's going to be helpful. But for cortisol particularly, collecting at different times of day can give me a picture into what might be affecting your pain, your anxiety, your sleep. If I see that you have this cortisol spike every night at 10 p.m., I know that's going to be the right avenue to go or to start with addressing sleep. If I see you have a cortisol spike mid-afternoon, we're going to look at what does your energy look like then? What are you doing that time of day? If you have low cortisol, I need to address that too, because that can be life-threatening. Insulin is also a hormone. The biggest driver of insulin production is eating. So sometimes adjusting when we eat can be really helpful for fixing sleep problems, because if you eat late, especially if you eat something high in carbs or something sweet, sugar itself is inflammatory. Sugar yields the release of insulin. Insulin is also pro-inflammatory. Inflammation can disrupt sleep. So that's something else that could be contributing to insomnia. Another thing that can contribute to insomnia is neurotransmitter production, serotonin, dopamine, norepinephrine, and quote unquote mental illness. I put mental illness in quotes because I'm always wanting to know, is this person, well, there's always a reason. I'll just say that. Mental illness does not just happen organically. Even if you say, oh, it's genetic. My mom had anxiety. My grandma had anxiety. Everyone has anxiety. Well, I can look at your DNA and figure out what genetically you inherited that's driving that anxiety. And then if we can make accommodations, if we can work around that and bring it down, that could help your sleep. If we find that inflammation is driving in your sleep issues, we can say, hey, based on genes, you're more vulnerable to overreactivity of certain inflammatory pathways. But because I know this roadmap for your body, I can make some targeted recommendations of how to address that. Looking at nutrient deficiencies is also helpful, because nutrient deficiencies can cause symptoms of mental illness. They can disrupt production of the right balance of neurotransmitters. For example, vitamin C is really critical for the synthesis of dopamine in the body. You have to have enough vitamin C. Now, I could just give everyone vitamin C, and that's not going to hurt most people, but wouldn't it be better to find out what you're missing? One of the things that's included in the micronutrient testing that I like, that you don't really see in typical hospital labs, is a nutrient called inositol. Inositol is really interesting because inositol is a precursor for hormone production, but we also find that it can affect blood sugar regulation, that it can have a huge impact on sleep, on anxiety, especially OCD type anxiety. And so finding out if you have an inositol deficiency, if that's a place to push, is really helpful, because we know, okay, this is a good use of resources. There's this deficiency, this presentation, that makes this a good intervention. Instead of just guessing, we can guess, But guessing takes time and costs money too, because if we don't guess right, we have to keep going down the list, and then you're accumulating a graveyard of supplements and devices that may not have been what was the best for your body. One of the main things that individuals describe to me when they talk about what keeps them up at night is racing thoughts. So again, with racing thoughts, what causes the racing thoughts? Are you having racing thoughts because of PTSD? Do you have a trauma that, especially at night when you're alone and it's quiet, comes up and your brain won't shut up about it? Do you have racing thoughts because of things in your environment that make it really difficult to be still, to be calm, to get into a restful state? Do you have racing thoughts because of infection or inflammation? I have seen very, very frequently individuals who did not previously have problems with anxiety. They get Lyme disease or Bartonella or another infection, and it causes anxiety. And when we treat the infection appropriately, the insomnia, anxiety calm down tremendously. And again, racing thoughts are a symptom of quote unquote mental illness, but I would always encourage individuals not just to accept a diagnosis of a mental illness without saying, but what caused this presentation? So yes, I may fit all the criteria for bipolar disorder, but what else is going on? What do my genes say? What do my nutrients? What do my hormones say? What can I maximize? Pain clearly can disrupt sleep. That's a no-brainer. If you have pain that keeps you up or that wakes you up, that's going to contribute to insomnia. And then lastly, sleep apnea and other physiological issues. So apnea literally means like without oxygen, without breathing. So when somebody has sleep apnea, they have periods of time when for various reasons they just stop breathing. So they may 30, 50, 100 times a night stop breathing for 30 seconds. That does not lead to restful sleep and can lead to a host of other problems. So now that we have kind of our list of things that can contribute to insomnia, the next question is what to do about it. What's the treatment or the intervention? So when we talk about the environment, a lot of that has to do with choices you make, but a lot of that has to do with who you live with. And I would just encourage you, if you're creating house rules or realistic expectations, to just not be a jerk. So, you can't say, I have to have complete quiet to sleep and I get very tired and my life is stressful. So at 6 p.m., I need everybody to not make noise anymore. Well, that's not realistic, but I think it is realistic to say, okay, sleep's really important. We want to create an environment in our house where everybody can rest. So quiet time starts at 9 or whatever you decide, and you can still be up, but if you have kids, I want you in your room at 9. And you also find ways to give other people grace. My husband and I aren't particularly loud people, but we do follow a college football team that plays on the West Coast, and we live out east, which means all the games are late. And so my kids have to just know that in the fall, once a week, there may be loud noises and screaming and cheering late at night. And they may find that disruptive, but it's just something they have to deal with, and we're kind to each other. My son's rolling his eyes at me right now. He does not like his dad screaming and cheering. But the same thing goes, like your kids have a party, they have people over. We make accommodations. We're nice people, but we have to be respectful. Another example of this that we've had to mitigate a little in our family, there's something called hyperacusis, which is not uncommon with inflammation, with chronic infection. Hyperacusis, hyper means high, and acusis, that's talking about hearing acuity. So basically, noises sound 1,000 times louder and more annoying to you than other people. And for a lot of people who have hyperacusis, they have a manifestation of it that's called misophonia, which is oral noises that really, really bother them. So chewing, talking, licking, that sort of thing. So if you have somebody in the home who has misophonia, I think it's respectful. Hey, they're coming into the room to get something. You're sitting there eating a snack. Oh, this person's in the room. Let's stop chewing. Let's wait for them to leave. We know this is bothersome. But on the flip side, you can't be that person who forbids other people to breathe and swallow and eat because you live in the same house as they do. There has to be some awareness of this pain is real. It's not imagined because I've seen the distress it causes, but other people have to chew and eat and lick and swallow. And so when do I set a boundary or ask for accommodation versus when do I just excuse myself because I'm having a really hard time listening to everyone eat, so I'm going to take my food and go to my room. You just don't be a jerk. I mean, that's basically what it comes around to. Try to be accommodating all around, but don't be afraid to let the people you live with know what you need, because there are many, many things I think we would do for the people we love if we were just aware that that's what they needed. So find kind ways to let people know how environmental things affect you and try to come up with compromises. Light is a big deal. I would recommend, as a rule, screens off at a certain time, or if you read at night, instead of reading on a device, just reading on paper at night, because you're less likely to stay up too late reading a paper book. You might if it's a really good one, but screens just feed that, especially the scrolling. Air purifiers, fans help some people just because of the noise and moving the air. And then again, with movement, just house rules. We have some people in our family who are just loud walkers and the house moves when they move around. Just saying again, hey, after a certain time, everybody try to kind of just hunker in your spot, stay up, do what you need to, but let's be cognizant of everyone else. When your emotional environment is affecting your sleep, the first thing you need to do is remove yourself from unsafe situations. Medication can't fix your situation. Medication's a Band-Aid. It's okay to use Band-Aids for a while, but you need to find safety. And I really encourage you to find a way to do that, to look to helplines, look to family, other resources to have a plan to move to a safe environment. The lack of safety might be coming from the people you live with. That's an issue, but if it's from your neighborhood or other things too, look for solutions. You're not stuck there forever. Sometimes we feel stuck, but if you look for solutions, look for helpers, there's a way out. You've got to feel safe to heal. PTSD, if you have PTSD, you need to treat the trauma. The past isn't in the past. And if we ignore the past, you're allowing it a passive but kind of intentional sabotage of your future. You have to address the past because you carry it with you. If you're not familiar with Dr. Bessel van der Kolk's landmark book, The Body Keeps the Score, I think the whole world should read it just for understanding. There are different things that you can do for trauma. Counseling helps some, but traditional taught counseling isn't always the best or sufficient for PTSD because individuals know what's logical, but again, their body has changed because of this. So EMDR is a really effective technique that some counselors do. We've talked about neurofeedback. Neurofeedback can be really helpful for resolving traumatic memories and helping the body feel safe again. A lot of times your treatment needs to be physical and not just mental. So movement, exercise, dance, the arts, creative expression, there are all sorts of things that can be part of that healing journey. And it does take time. There's not a quick fix, particularly if there's something that affected you as you were developing. If you did not feel safe as a child, it's going to take a long time to learn to feel safe as an adult, but you can heal. If you feel that your sleep's being disrupted by caffeine, alcohol, medication side effects, those sorts of things, first of all, stop. If you're drinking at night, don't. If you're having caffeine at night, don't. As I said before, alcohol is a sedative. You may fall asleep easier, but it will be a fragmented, non-restorative sleep. Look at medication side effects. Look at, as I mentioned before, are you sleeping during the day because you're taking your muscle relaxant at 10 a.m. and then you can't sleep at night? You can, for a lot of things, reach out to your provider to see if you can take a lower dose. Most tablets, you need to check with your pharmacist or provider. Most tablets can be broken in half. So if it's something that is causing sleep deprivation or oversleeping during the day, but you feel that you need it, you can check with your provider to see if it would be safe just to try a lower dose. Dose is a big, big deal. And there are a lot of things that I think just by dialing back dose, we can help. But doing a medication review, looking at meds, side effects, lack of routine is pretty straightforward. If you don't have a routine, get one. It doesn't have to be strict down to the minute, but your body needs to generally know this is when Krista goes to bed. This is when Krista gets up. These are the things Krista does after dinner. This is when Krista stops eating. It doesn't mean you can't ever vary from the routine, but it is really, really, really helpful. When it comes to hormones, again, if we can fix your sleep by fixing your hormones, you're going to have multiple wins. I actually met with a woman yesterday who was a great illustration for why we really now insist on hormone testing before treatment for Lyme and other vector-borne infections, because it is a vicious cycle. We don't always know what starts what, but even if you didn't have hormone issues before, infection, particularly Bartonella, can really, really affect and disrupt hormone production. So when this individual came to me, was diagnosed with infections, including Bartonella, pain, all sorts of issues, but she told me she was planning her funeral. She just did not want to be alive anymore, was planning her funeral. The main thing we did for her was fix her hormones, and her life has dramatically changed for the better. She's sleeping better. Intimacy is possible again with her spouse, which hadn't been for years. She has less pain. Her mood is more stable. Her energy is improved. She's been able to do a lot of other healing things because we raised the floor just by fixing hormones. So I feel that as a provider, if I dive in and start treating you for Lyme disease and you've had symptoms for a long time, but I fail to first address hormones and nutrients and toxins, that's really not good practice for me, because why would I want to put someone on extended treatment for infection if the majority of their symptoms resolve with hormone replacement? That's just crazy. And even if we still do need to treat after that, because not everybody is that dramatic of a response, okay? But if I fix your hormones and I get your sleep better and you're feeling calmer, your pain's better, your energy's better, you're going to tolerate other treatment exponentially better. It's fantastic. Cortisol. So cortisol, again, is one of those hormones. High cortisol can mess with sleep. I love that 24-hour saliva test. What's the intervention if somebody has high cortisol? So there are a lot of different things you can do lifestyle-wise and supplement-wise. Lifestyle-wise, exercise can be really, really helpful. So figuring out an exercise routine and the timing of exercise during your day. Some people sleep better if they exercise later in the day. Other people find that stimulating and they need to exercise earlier. But regardless of what your sweet spot is, a sedentary lifestyle can make insomnia worse. Sugar can raise cortisol, so reducing sugar. And again, if you're having something higher in carbs, you want fat and protein too. You want that with it. You don't want just straight sugar. Also, herbs, especially ashwagandha and other what are called adaptogenic herbs. Orthomolecular has a product I really like called New Adapt. We carry it as Ultra Adapt on our label if you go to our website, but Ultra Adapt I love. I am prone to high cortisol and high dopamine based on my DNA, and I take this stuff twice a day, every day, because I realized even though it helped as needed, I was doing a little of this yo-yoing up and down, and if I just took it consistently and I said, hey, I'm wired this way. If I'm wired this way, why don't I just work on addressing that wiring? And it has really helped improve the baseline. Melatonin is another hormone. Melatonin has gotten kind of a bad rap because people have very strong opinions. You shouldn't use it. Your body will stop making it. It's not natural. I will tell you, not sleeping is not natural. Not sleeping is really, really bad. And if you can take a couple milligrams of melatonin and you sleep, I would do it. Melatonin's actually anti-inflammatory. It's got some brain protective benefits. Unfortunately, for a lot of my patients, just melatonin's not going to do it. But if it works for you, to me, the risks of sleep deprivation far exceed any potential theoretical risks of melatonin use if it's effective. Light therapy can help with turning melatonin on and off. So having that ongoing light stimulation later in the day is going to prevent the melatonin. But if you're someone who has prolonged high melatonin levels, which our saliva tests can tell us, and my son and husband are two of these, you look at their melatonin, it is sky high, like through the morning into the afternoon. And we found out through their genetic testing that that is a genetic thing. Some people have this excessive and prolonged production of melatonin, which actually puts them at high risk for type 2 diabetes. So intermittent fasting is a really good intervention for those people. But then also light exposure in the AM to turn off the melatonin and get the body into healthier circadian rhythm. And because so many of us spend so much time indoors, we just have to be more creative about that. I mean, right now it's been like -3 at some point this week, and there's still a couple of feet of snow outside my door. And so I'm not going to sit on the porch, but you can use light, full spectrum light, red light. You can still go outside, face a window, those sorts of things. You have to be very deliberate about it, but light therapy can help get your body into a better natural circadian rhythm. Insulin, as we mentioned, is a hormone. Intermittent fasting can be great for preventing hyperinsulinemia and insulin resistance. The nutrient testing can also be helpful for this, because if I have someone who has deficiencies, say in chromium, alpha lipoic acid, biotin, the inositol that I mentioned, all of those contribute to blood sugar regulation. So by addressing those nutrients, sometimes that can help bring insulin down, which also will improve sleep and other things. With mental illness or neurotransmitter production, DNA tells us a lot of things. It tells us, for example, is it a serotonin problem? This medical community talks about mental health like it's mostly a chemical imbalance and people need more serotonin, and we prescribe these SSRIs, selective serotonin reuptake inhibitors, like your Zoloft, Paxil, Prozac. They're prescribed for everything. But some people, you get their genes back and there are no or minimal vulnerabilities that have to do with an inability to produce enough serotonin or norepinephrine, or a problem with serotonin receptors or dopamine receptors. Now, if we find out that is it genetically, then we can do cool things about that. We can do things to boost serotonin production and help those receptors work better. We can say, you know what? Medication might be a good option for you. Maybe a low dose of an SSRI is worth a try based on your genes, but it's not for everyone. Some people, severe anxiety, OCD, they come back and there's nothing in those genes that have to do with serotonin production, which is confirmed by the fact that said individuals have frequently been on all those meds and they've done nothing for them. But it shows that you are genetically very prone to a GABA glutamate imbalance. GABA is a calming neurotransmitter. Glutamate is an excitatory one. So if somebody is dragging around with too little GABA and way too much glutamate, that can really, really mess with mood. It can mess with sleep. It can cause a presentation of a mental illness. As I mentioned previously, I make too much dopamine. So I know based on DNA what to do about that, which has helped my sleep be more solid. Nutrient deficiencies, finding that can be helpful too. Are inositol and magnesium sometimes great interventions for sleep? Yes, but not for everyone. And if we look at somebody's results and we say, well, they have really robust levels of these things, we're not going to keep giving them something that's not going to address a problem that they have. Sometimes we see, oh, they've got all these antioxidant deficiencies. That's going to drive ongoing inflammation, which can mess with sleep. So even though it's working kind of through the back door as we boost their antioxidants so their body can detoxify, then they sleep better. You may have deficiencies in the methylation pathway or mitochondrial dysfunction. So finding out those deficiencies is really, really helpful. Again, I can say to people, well, what we need to do is we just need to help you methylate better. Some people are obsessed with methylation, and it is important. Or what we need to do is get your mitochondria working better. Those are great things in concept, but what is the issue for you? Do you have deficiencies in those things? It may not be where we want to spend our energy, and you may be wasting time and money because not because those aren't good interventions, but they're not the right ones for you. Organic acid testing, also very cool. It's a urine test, so no blood, but it looks at deficiencies in neurotransmitter metabolites and nutritional precursors, which help you identify and correct. Like we said, it might be as simple as vitamin C for some people. It might be a B6 issue. So it can give us a lot of clues about where to put our energy. Racing thoughts, as we mentioned, it could be PTSD, your environment. It could be infection or inflammation. If that's the case, what you've got to do is identify and treat. One clue to whether or not your insomnia or racing thoughts are related to inflammation is to do something anti-inflammatory. And if the insomnia improves or the racing thoughts improve, then you know inflammation is a driving factor. If you take Advil and you sleep better because your mind calms down, that's inflammation. I think that's why Benadryl is particularly effective for some individuals and not at all for others. But I have some really tricky insomnia patients that Benadryl is like gold. Well, Benadryl is an antihistamine. Excess histamine causes inflammation. So I'm always thinking if somebody's used Benadryl and they find it's exceptionally effective for sleep more than other things, I look closer at inflammatory causes to see if I've missed anything. Toxins are also inflammatory and they disrupt hormones. So again, by finding out if there are any toxins, mold or other environmental toxins, treating those, it's not necessarily that you'll immediately be able to sleep, but if we get the bad stuff out of you, hormone production stabilizes, you don't have your body always trying to fight and keep up with all the bad guys that are swimming around inside you, then your sleep naturally corrects itself. Pain is obviously a tricky one. I love the idea, though, of any intervention that can help pain and sleep. They help the sleep by helping the pain, but they also have standalone benefits. And the great example of that is LDN or low dose naltrexone. We do have an episode on that with Brad White. I'd encourage you to look up if you're not familiar with LDN. But LDN is anti-inflammatory, and for some people, it really, really helps sleep. Now, caveat, there are a handful of people that it keeps wide awake, so we just have them take it in the morning. But for some people, that's a great dual intervention. Muscle relaxants, if you have severe tension, obviously that has to be prescribed, and you want to make sure you're using the right dose. You're not taking it with other things like alcohol that are a dangerous combination. Medical cannabis can be very good for some people. Getting exercise to be part of your routine, saunas, all of those sorts of things can help your pain directly and help your sleep directly, but also even more so as your pain level comes down. Sleep apnea and other physiological issues, you've got to identify them and treat them. Right now, there are home sleep studies that are very, very affordable. So it's not like you have to have great insurance or pay a couple $1,000s to go sleep in a lab. I think the home sleep tests are great, especially because people are more likely to do them. I can say, oh, the hospital sleep test is so superior technologically, but how well do you sleep in a strange place? And if somebody's not going to do it, it's useless. So I would much rather do a home sleep study that I think they're fantastic. And then you just have to identify, do you want a CPAP versus a mandibular advancement device, which is an orthodontic device that can help that. But taking care of sleep apnea and breathing and getting enough oxygen to your brain can help. Last stop, what are your medication issues? And I don't want to say when all else fails, take medication, because sometimes we have to take medication while we're fixing these other things, because it's going to take a while to get those hormones in balance or get rid of toxins or correct nutrients, and not sleeping is detrimental to your emotional and physical health. So I think sleep is super, super important. If you're looking at supplements, again, it's more helpful to know, is this root cause medicine? So is this person have high cortisol at night? Then yes, ashwagandha is going to be a great intervention for them, but not for someone else. Myo-inositol at bedtime can be really, really helpful. You can take up to 6 grams of it. A combination for some people of myo-inositol, 5-HTP, and magnesium. Magnesium alone helps some individuals. You have to watch the form. There are a lot of different forms. Mag-threonate is calming to the brain. Mag-glycinate is more calming to the muscles. Melatonin for some individuals. Valerian root, lemon balm. Again, there are a lot of combination supplements, and what you're looking for is something that works. I don't think we have to get much fancier than that. If it works without any significant adverse effects, go for it. We've talked about melatonin, which can be taken alone or in combination with valerian root and lemon balm and other things. We mentioned Benadryl. If Benadryl works for you for periodic insomnia, just take it. It's cheap, it's easy. I don't have an issue with that at all. If it's something you have to take all the time or it stops working, then we need to look a little more closely, but it's a great intervention. Again, caution with alcohol. With anything that affects sleep, you have to use caution with alcohol and other drugs. Prescriptions, this could be a lengthy conversation. I'm just going to mention briefly the ones I use the most and why. I like to start with trazodone or doxepin. They're old, they're cheap, and they help with that restorative delta sleep, okay? I don't just want you to fall asleep, I want you to stay asleep. Trazodone and doxepin can both help with that. We use them typically at much lower doses than what they were used for depression 50 years ago, but we find them to be really, really effective. A tricyclic antidepressant, again, these are older ones like amitriptyline or nortriptyline. For some people, those are great because they can help nerve pain and they help some individuals with sleep. They either do or they don't. If they don't, leave it behind and find something else. Benzodiazepines, this is a little tricky. That's your alprazolam, lorazepam, clonazepam, which is like your Klonopin, Ativan, Xanax, that sort of thing. They've gotten a bad rap. They actually can be really good for sleep architecture, but you don't really want them to be something you have to take all the time. They're best for as needed use. And my preference is for somebody to take GABA plus magnesium and B6, and there are some combo formulas for that, because if you take GABA with cofactors, it binds to those benzodiazepine receptors. It can be just as effective. I do have a few people who it's the only thing on planet Earth that helps them sleep. And if they've done everything else, I don't have an issue with it, as long as we're aware of risks and we're doing everything else we can to mitigate. Gabapentin and Lyrica get used in the prescriptional world a lot for pain and sleep. I don't really love them. I do use them occasionally, but we always start at the lowest possible dose, because where you get into issues with medication side effects is at higher doses, particularly of gabapentin. High doses of gabapentin can cause many more problems than they solve. And then you also get into Ambien, Belsomra, some of these prescription medications that are developed and marketed specifically for sleep. They've got some benefits, they've got some risks. Again, I would look at that as kind of last line, or as something you do occasionally, PRN, or maybe as a stopgap. Okay, I'm desperate. I haven't been sleeping for weeks or months. I have to do something now while we try to figure out what caused this, because you can say, I don't need to find out anything else because I take this pill and all my problems go away. But I found for a lot of people, if you don't figure out the root cause, eventually that magic intervention isn't going to be as effective anymore, and you're going to be back to where you started. But your most important priority is immediate, which is figuring out how to sleep now while you figure out how to help your sleep be more restorative and heal. And don't look at sleep as a burden. It's a blessing. It's this ridiculous concept that some people have that people are superheroes who just don't need much sleep. They need more than they let on, and the most of them are going to be happier and nicer too if they figure out how to get in a routine and how to get good sleep and choosing a life that's sustainable. So sleep, an important part of healing, important part of health and prevention. I encourage you to make your sleep a priority and to remember to have hope because you were made to be whole.
Have a podcast question or suggestion? Text or call us on the podcast info line at 330-439-0686. Thank you for spending time with me today. If you like what you hear, please subscribe to be notified when new episodes release. And remember, you were made to be whole.